Hello, my name is Rachel Antonese, and I am a junior nursing student at Bloomsburg University. Today I'm going to present on healthcare in developing countries. I chose this topic as it is very relevant to my major of being a nursing student. Healthcare is the maintenance and improvement of physical and mental health, especially through the provision of medical services. Many underdeveloped countries don't have access to simple healthcare. This leads to unnecessary deaths and a death that could be avoided. Access to healthcare is very important. In some underdeveloped countries, people may not have any access to healthcare at all. Access to healthcare impacts one's overall quality of life, physical, social, and mental well-being. It also promotes and maintains health, can help manage and prevent certain diseases, and reduces unnecessary disabilities and premature death. There are many reasons why people may not have healthcare. Some of these barriers to healthcare include high cost of care, inadequate or no insurance coverage, lack of availability of services, or lack of culturally competent care. In regards to underdeveloped countries, most people may not have the money to afford the cost of medical care. They probably don't have any insurance coverage. There aren't many doctors or nurses available, or the healthcare that is available is too far from them and they have a lack of transportation. And some people in underdeveloped countries may not believe in healthcare and may rely on more herbal or spiritual care. Although there are many countries that are considered underdeveloped, the top 10 most underdeveloped countries in the world today are Togo, Madagascar, Afghanistan, Guinea, Mozambique, Ethiopia, Mali, Guinea-Bissau, Comoros, and Haiti. 80% of people in developing countries rely on ill-equipped local healthcare. What I mean by ill-equipped is that they do have medicine, sterilized needles, and supplies, but they often have a shortage of them. So it is typically on a first-come, first-served basis. The medical instruments they do have often malfunction due to unstable power supply, and the rural areas of underdeveloped countries lack basic medical care at all. Many people in underdeveloped countries rely on local health care. There are no ambulances and there is no 911 phone number that people may call. So if there is an emergency or somebody is sick, they may have to walk for days to get to the local clinic or hospital, and when they get there, they may have to wait hours to be seen. If there is a true emergency, one article stated that people may wait outside of the hospital or clinic at 3 a.m. or for multiple hours just to try and be able to get seen in that day. Another article stated that some people are frightened of the doctors, and when doctors do try to help them, they hide their kids or have their animals attack them. So this also is a reason why there is a lack of health care in underdeveloped countries. There is an obvious link between the lack of health care in underdeveloped countries and the lack of money that these people have. Using money for basic care is more cost effective than using it for expensive treatment. One article gave an example that $5,000 could treat leukemia and add a bit more than a month to a patient's life, and that same $5,000 could be used to buy vitamin A supplements for children and could add a total of 10,000 years of life expectancy. So these parents in underdeveloped countries would rather spend the money on the vitamins than the life-saving treatment. Another issue is that high medical bills can devastate a poor family in these areas. The same article gave an example and stated that there are vaccines for measles that cost 50 cents a child and are fairly easy to give, but still some of these children don't get them because the vaccine is too expensive. This gives a huge reason why many people don't immunize their children in these areas, because one needle that costs 50 cents can make a family be poor and have no money for months at a time. The hospitals and clinics in underdeveloped countries are few and far between. Many of these hospitals or clinics are run by church organizations. There are good clinics and there are bad ones. Most of them are clean and neat, and the doctors and nurses are well trained and disciplined, but most of them lack the supplies that are needed, such as medicine and sterilized needles. Like I said, there are some bad clinics. A typical rural clinic is made of cement blocks and has unglazed windows and no screens. There aren't any fans and flies are everywhere. The worst clinic has nothing, and medical care is provided on a day-to-day basis by an 18-year-old villager with some knives and instructions to give out malaria pills if somebody has a fever. The hospitals and clinics do have good medicines and vaccines, but they lack the infrastructure required, such as refrigerators, clean syringes, and nurses. Some needles are reused, spreading disease and infection more than they are already spread by the lack of proper hygiene. Vaccines are given even though their effectiveness has been compromised by the lack of refrigeration. Although they are bad, these are the only clinics that are available in these underdeveloped countries. Diseases in underdeveloped countries are spread very easily due to the lack of proper hygiene. People don't keep their water covered, wash their vegetables, brush their teeth, vaccinate their children, or screen their windows. This lets in flies and mosquitoes, and as you may know, mosquitoes do carry malaria, which is one of the #1 causes of death in underdeveloped countries. There is also a lack of proper waste disposal. Waste builds up in the streets, which is a perfect ground for bacteria and germs, which attract rats and other rodents who transmit the diseases. This slide is a great example of the lack of healthcare that really exists around the world. For example, low-income countries have 9 hospital beds per 10,000 people, 0.49 doctors per 1,000 people, and 0.83 nurses per 1,000 people. In Africa, there is less than 1 hospital bed per 10,000 people, 0.21 doctors, and 0.93 nurses per 1,000 people. This is an insane low number, which would show why there are so many diseases spread and so many deaths that could be potentially avoided if there was proper health care, such as more hospitals, more doctors, and more nurses available. Respiratory tract infections, diarrheal diseases, tuberculosis, malaria, and AIDS account for 90% of the deaths in underdeveloped countries. Tropical diseases account for the other 10%. Respiratory tract infections could be simply avoided with antibiotics or certain medications. Diarrheal diseases could be avoided if the people in these countries were aware of the proper hygiene measures that should be taken. Tuberculosis and malaria could also be avoided by antibiotics or vaccination, and AIDS is a common issue in underdeveloped countries that healthcare workers and healthcare system is trying to fix right now. I wanted to bring up a specific point about women and children and their endangerment in underdeveloped countries. According to the World Health Organization, 290 women died per 100 live births. The most common causes are infections, major bleedings, as well as unsafe abortions. Nearly 1 child in 10 dies before having its first birthday. 16% of children do not live to see their 15th birthday. 1/3 of all cases of childhood death are caused by infections of the respiratory system or diarrhea, which could be avoided with low medical expenses such as vaccinations. If there was proper healthcare workers such as a doctor or a midwife performing the birth of a child, they could avoid the major bleeding and the deaths of the women, as these people know what they're doing. In these countries, most women prefer to have somebody, such as a family member, assist in the birth when they do not have the proper medical training to help if a person is having a hemorrhage or the baby isn't breathing or other things that could lead to death during a birth. To wrap it all up, there is an obvious lack in healthcare in underdeveloped countries. Geographic accessibility, availability, financial accessibility, and acceptability all play a role in this. Geographic accessibility is very difficult for people who live in rural areas because it is very far away and there are no ambulances that can get them there, and there tend to be no cars in underdeveloped countries. There is a lack of availability of healthcare in these areas as well, as there are few doctors and nurses that are trained in this area. Money plays an issue in this because most families don't have much money and save their money for other things such as food or the simple healthcare issues, but not the big ones. And acceptability also plays a role in this, as some people in these areas are scared of doctors and scared of nurses and would rather have their own family members take care of them when they are sick. As the world continues to move and grow, there needs to be more of an importance on the lack of healthcare in underdeveloped countries, because a lot of the issues that take place in these countries could simply be avoided if there were more doctors or more nurses or even more education for these people so they know that all the doctors and nurses are trying to do is help them and explain to them the advantages of vaccinations and the advantages of medicines that they're taking and teach them about proper hygiene, because as I stated before, hygiene is the number one reason that the diseases are spread from people to people, because they don't understand how to keep their water clean or how to wash their vegetables or why it's important to wash their vegetables. So overall, there just needs to be more of an impact and more importance on the lack of healthcare that occurs in underdeveloped countries. And as the world continues to grow and move, we should be able to help these people more and more.